My name's Dr. Noel Ryman. I'm one of the haematology consultants in HHFT. I've been involved in research from university when I did a degree in medical genetics, but I've continued to be involved throughout my training in haematology and now as a haematology consultant. In my day-to-day job, I look after patients as an outpatient who attend clinic, but also those patients who need to have chemotherapy as an inpatient within Basingstoke Hospital. We also are involved in the haematology laboratory. Our current research includes predominantly research into blood or haematological cancers, but I have a particular interest in myeloma as well as lymphoma. The RADAR study is one of our most recently opened trials. This trial is looking at patients who are newly diagnosed with myeloma, which is a form of blood cancer, and it's looking in particular at those who are young enough and fit enough for stem cell transplantation. The RADAR study compared to standard practice allows you to give slightly different initial treatments to try and put patients into a remission, and then following stem cell transplantation it allows you to stratify different groups in a risk adapted approach so that those that still have some disease left or on board can be offered stronger and longer maintenance and consolidation approaches, whereas those that are potentially in a very deep remission can be offered less treatment. We work as part of our trials very closely with our research nurses. They try and provide us oversight and help with the trials to make sure we're following the trial protocols. As well as the research nurses, we have a large team which help with research, including the chemotherapy nurses on the Rainbow unit, our research pharmacy team, but also our administration team and other colleagues in both Winchester and Basingstoke are also involved in recruiting patients to the trial and helping look after them. We were lucky enough to be awarded the Myeloma UK Clinical Service Excellence Programme Award. This assessed 8 different categories, and one of these was research, and I'm pleased to say that thanks to our wonderful research team we achieved excellent in that category as part of this award. The main reason that I am very passionate and keen to promote research as part of our clinical service is that it provides overall better outcomes for our patients who are involved in the trials, but also potentially in the future continuing improvement in patient outcomes as we've seen in the last 2 decades of myeloma care.